NCLEX RN Exam Prep 2026 questions to help you pass with confidence. Question 1. The primary physiological alteration in the development of asthma is Option A. Bronchial inflammation and dyspnea. Option B. Hypersecretion of abnormally viscous mucus. Option C. Infectious processes causing mucosal edema. Option D. Spasm of bronchial smooth muscle. The correct answer is option D. Spasm of bronchial smooth muscle. While asthma is a chronic inflammatory disease, the acute clinical manifestation is primarily caused by the spasm of bronchial smooth muscle, bronchospasm. Question 2. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should: Option A. Serve high-calorie foods she can carry with her. Option B. Encourage her appetite with favorite foods. Option C is serve her small, attractively arranged portions. Option D, allow her in the unit kitchen for extra food. The correct answer is option A. Serve high-calorie foods she can carry with her. Clients in a manic state are often too hyperactive to sit for meals. Providing high-calorie finger foods allows them to eat while on the move. Question 3. To maintain Bryant's traction, the nurse must make certain that the child's Option A. Hips are resting on the bed. Option B. Hips are slightly elevated above the bed. Option C. Hips are elevated on a pillow. Option D. Hips and legs are flat on the bed. The correct answer is option B. Hips are slightly elevated above the bed. In Bryant's traction, the child's buttocks should be slightly elevated off the mattress to provide the necessary countertraction. Question 4. Which action by the nurse indicates understanding of the care for a client with herpes zoster? Option A. The nurse covers the lesions with a sterile dressing. Option B. The nurse wears gloves when providing care. Option C. The nurse administers a prescribed antibiotic. Option D. The nurse administers oxygen. The correct answer is option B. The nurse wears gloves when providing care. Herpes zoster, shingles, is transmissible through direct contact with the lesions, therefore, gloves must be worn during care. Question 5. A trough level is ordered for a client receiving vancomycin. The nurse should have the blood collected. Option A. 15 minutes after the infusion. Option B. 30 minutes before the infusion. Option C. 1 hour after the infusion. Option D. 2 hours after the infusion. The correct answer is option B. 30 minutes before the infusion. Trough levels are drawn when the medication is at its lowest concentration in the bloodstream, which is typically 30 minutes before the next dose. Question 6. The client using a diaphragm should be instructed to: Option A. Refrain from keeping it in longer than 4 hours. Option B. Keep the diaphragm in a cool location. Option C. Have it resized if she gains 5 pounds. Option D. Have it resized if she has any surgery. The correct answer is option B. Keep the diaphragm in a cool location. Diaphragms should be stored in a cool, dry place to prevent the degradation of the rubber or silicone. Question 7. Which statement by a mother planning to breastfeed indicates the need for additional teaching? Option A. I'm wearing a support bra. Option B. I'm expressing milk from my breast. Option C. I'm drinking 4 glasses of fluid during a 24-hour period. Option D. I'll allow the water to run over my breasts in the shower. The correct answer is option C. I'm drinking 4 glasses of fluid during a 24-hour period. Breastfeeding mothers require significantly more hydration, typically 8 to 10 glasses of fluid per day, to maintain adequate milk production. Question 8. Damage to the 7th cranial nerve results in: Option A. Facial pain. Option B. Absence of ability to smell. Option C. Absence of eye movement. Option D. Tinnitus. The correct answer is option A. Facial pain. Damage to the 7th cranial nerve, facial, affects facial expression and taste. However, it is frequently confused with the V nerve, trigeminal, which causes facial pain.